Hi friends, today we are going to talk about knee pain, arthritis and the treatments available. I am Dr. Guru Reddy, a Chief Joint Replacement Surgeon in Sunshine Hospital, Hyderabad. I spent last 25 to 30 years in treatment of arthritis and in knee replacement surgeries. A lot of people got many misplaced notions about knee pain, arthritis and the treatments available. Today I am planning to give you more clarity about these issues and dispel many myths which are hovering around the horizon. First of all, the commonest questions asked about the knee pain is, does everybody get arthritis? Yes, everyone who is walking on his both feet will get arthritis of the knee joint. It doesn't mean that everybody needs an operation. What is the knee pain and what is arthritis? Arthritis means basically, itis means inflammation or swelling. Arthra means joint. So arthritis means it is a swelling of the joint. If you take the human anatomy, if you see here, this is the normal joint. This is between the thigh bone and the leg bone, what we call femur and the tibia. In between there is a smooth cartilage. You can see that the light blue color thing, that is what we call cartilage. It is just like a wet coconut in the younger age, and this joint also has got some other ligaments on both sides and like some ligaments inside, and there are a couple of washers inside, what we call menisci. So that is the normal architecture of the knee joint. As we grow older, the knee joint gets dried up, or in other words, the cartilage in the joint becomes thinner and slowly there will be some cracks developing. You can see that there is one crack here. So this is the, let us say we will do it as a second stage of arthritis. How do you know that this arthritis is started? After the age of 50, you will start having discomfort in the knee joint. Number 2, you will have morning stiffness. That means the moment you wake up in the morning, your knee feels a bit bloated. And number 3rd symptom is, while going up and down the stairs, your knee starts hurting you. And 4th symptom is creaking sounds. In technical terms, we call that as crepitus. So these 4 are the main symptoms, and they will tell you that your joint is getting worn out. People keep on asking me, what are the situations where the knee joint gets arthritic? Number 1 is age. That means it is an age related process. Just like all the buildings, all the material get worn out or rusted, your knee joint also will get rusted. In other words, will get worn out because of the age. Is there any restriction of the age for arthritis? No. The arthritis can come anytime, but usually osteoarthritis comes at the age of 50 onwards. And number 2, there are 2 main types of arthritis. One is osteoarthritis, second is rheumatoid arthritis. Osteoarthritis is the arthritis which happens as you grow older, whereas rheumatoid arthritis is a autoimmune disorder where God blesses you with joint pains and you will have an arthritis, and that too in a younger age, what we call juvenile rheumatoid arthritis. The commonest form is osteoarthritis, where you will have this wearing out of the cartilage, and as you grow much older, your cartilage becomes more and more damaged. You will come to a stage where this cartilage becomes like this. You can see that all that light blue cartilage is worn out or shaved off the bone, and now the bone is become very rough, and there is a blood accumulation inside, there is a swelling, and there is a deformity where the legs will be bowed. In other words, it's called bow legs phenomenon. This is the 4th stage of arthritis. And in addition to the age, what is the other condition that will affect the arthritis? It is undoubtedly the weight of the person. That means if you weigh overweight or if you are morbidly obese, your knee joint will go for a toss sooner than later. For example, if you weigh 70 kgs, your both knee joints will take 35 kgs each, whereas if you weigh 120 kg, both of the knee joints will take 60 kg each. That means every time you put your foot on the ground or every time you take a step to walk, each joint is taking 60 kilos, in other words 30 kilos more than the normal. That will obviously damage the joint and the cartilage will become like this. So that's why you cannot reverse the age, but you can take care or control your weight. That's why keeping yourself a proper weight according to your height is a paramount importance in having a good knee joint for you. Now once people ask me what is the treatment for the arthritis. When you are in the first or second stage of the arthritis, you don't need any operation. Again, there is a myth here that patients think that if you go to doctor, he will tell operation for everything. No. In fact, for every 100 patients we see in the outpatients, only around 10 to 15 patients need joint replacement. The rest of the people, we give them the medication and we advise them good physical therapy. And there are some other precautions also you have to take. Number one, you should not sit on the floor in a squatting position like we use the Indian toilets, because 4 times body weight goes to the knee joint if you squat. Like that, another situation which hurts the joint is going up and down the stairs. Many people think going up and down the stairs is good for your health. No doubt it is good for your heart, but it is bad for the knee joints. So avoid going up and down the stairs. So age, weight and abuse of the knee joints like sitting on the floor, using the Indian toilets and going up and down the stairs are bad for the knee joint. Once in the early stages, the treatment is entirely different, and in the later stages the treatment is entirely different. And for learning about the treatment, we will see you next week.